Welcome to the Men's Healthcare channel. Today, we're going to talk about a topic that is both sensitive and intriguing and also the source of many quiet worries. What exactly is the normal size of a penis? And more importantly, how do you measure both length and girth accurately? In this era, where more and more men are turning to intimate enhancement methods, from medical clinics to those miraculous online ads, this is no longer a taboo subject. But before diving into the details, there's something that might surprise many of you. Around 95% of men who feel dissatisfied with the size of their penis are actually still within completely normal limits. In fact, the issue often doesn't lie in the body, but in perception, especially when comparing oneself to what's often shown in movies or on sensitive websites, where everything is carefully selected, exaggerated, or even digitally edited like Hollywood special effects. And here's something else that's interesting. Women actually don't care about this as much as most men think. While more than half of men feel insecure about their size, only around 5 to 10% of women say it's a truly important factor in a relationship. Just hearing that should be a relief, right? But don't leave just yet, because the next part is something most people have probably never been taught properly. How to measure your size the right way, in the right place, and at the right time. Before we get into today's content, may I ask you a small question? Where in the world are you watching this video from? I would be so happy to know who I'm sharing this moment with today and where these insights are reaching. Please leave a greeting or share the name of your city or country in the comment section below. And if you find this topic worth exploring further, don't forget to hit the subscribe button and turn on the notification bell. So whenever there's a new video, it'll knock on your door right on time like an old friend. Now let's move into the first part, where the truth and the measuring tape will both speak up. Part 1. How to measure penis size scientifically and accurately. When talking about penis size, there are two important numbers that every medical statistic is based on. Length and girth, also known as thickness. It sounds simple, but in reality, many men measure it incorrectly without even realizing it. Some do it by eyeballing, while others compare themselves to images on the internet that have been carefully selected, edited, or even exaggerated. This only adds to the worry and doesn't reflect the truth. So how do you measure it correctly? First, let's talk about length, and there are two common ways to measure it, when flaccid but stretched and when fully erect. Both methods are used in research, but in clinical settings, measuring while flaccid but gently stretched is considered to give the most stable and reliable result, close to the erect length. The proper steps to measure length include: first, use a straight ruler or soft measuring tape. Second, place the start of the ruler at the pubic bone where the penis connects to the body. If there's a fat pad in that area, gently press down to reach the bone for accuracy. Third, gently stretch the penis along its natural axis, just enough, not too forcefully, and measure to the tip. If you want to measure while erect, you also start from the pubic bone, measure to the tip of the penis, and keep the ruler straight and aligned along the top of the shaft to avoid adding false length. Many people make the mistake of measuring from the skin or from underneath, which can significantly distort the result. As for girth, this is just as important, because in fact, many studies have shown that the perception of size is often influenced more by thickness than length. To measure girth accurately, you can do the following. Use a soft measuring tape or a piece of string. Wrap it around the middle of the shaft, not too close to the base and not too near the tip, then mark the point where the ends meet and record the number. You can do this both when flaccid and erect, but in most research, erect girth is the standard used for comparison. And one small but very important note: don't compare yourself in a non-erect state with images of others in a fully erect state. That kind of comparison is like entering a bicycle into a car race. It will never be fair and will only make you feel unnecessarily inferior. So, after learning how to measure correctly, the big question is: does your number fall within the normal medical range? And how have scientists around the world compiled that data? We'll find out in the next part. Dear friend, if you're still watching at this point, I'm really glad you care about the topic of penis size and the common misconceptions surrounding it. Please leave the number 1 in the comments below to let me know you're still with me in this video. Part 2. Scientific data on global average penis size. Now that you know how to measure correctly, let's see what science actually says about the normal number. A large-scale meta-analysis was conducted based on data from nearly 15,000 men around the world, covering all races, age groups, and regions, which helped establish average measurements objectively and reliably. In terms of length, whether measured erect or flaccid and stretched, About 90 to 95% of men fall within the range of 10 to 16 cm, roughly 4 to 6'3" inches. The global average is around 13.2 cm or just over 5 inches. So if you're somewhere in this range, congratulations, you are completely normal physiologically. Of course, there are some cases on the extreme ends of the spectrum. A penis is considered too small or micropenis if the erect or stretched length is under 7.5 cm or about 3 inches. On the other hand, if the length is over 24 cm or more than 9.5 inches, that's considered an extremely rare case known as macropenis. But to be clear, both are statistical outliers, representing only a very small percentage of the population, something you're unlikely to encounter in everyday life unless you work in the adult film industry. As for girth or thickness, the numbers also have clear benchmarks. Flaccid girth usually ranges from 8 to 10.5 cm 3.1 to 4.1 inches with an average of about 9.5 cm. Erect girth averages around 11.5 cm or approximately 4.5 inches, and most men fall within the 10 to 13 cm range. The issue is many men develop distorted perceptions by comparing themselves with unrealistic images online, where camera angles, lighting, and post-production can make things look far more impressive than they really are. Plus, performers in the adult industry are often selected specifically for their above-average size, so they don't represent the general standard. What you need to remember is this. If your measurements fall within the ranges above, you are part of the majority. And even if you fall a bit outside, that does not define your health, your attractiveness, or your masculinity. However, not everyone feels comfortable accepting that reality. Many still turn to various methods, from pills to procedures, hoping to enhance or change their size. But are those solutions truly effective, or do they come with serious risks? We'll explore that in the next section, where bold promises are measured against scientific facts. Part 3. Size Enhancement Solutions. Be careful between expectation and reality. Many men, after measuring and comparing their size to the average statistics, start to wonder, is there any way to make it bigger? In reality, wanting to improve one's body is totally understandable, and there's absolutely no shame in that. But the important thing is to clearly distinguish between medically supported solutions and advertisements that only drain your wallet without improving anything. Among the most commonly mentioned methods today, increasing girth is the more popular goal. One technique being applied in many medical facilities is the injection of hyaluronic acid, a substance also used in facial fillers. When injected into the shaft of the penis, it can increase girth by 2 to 3 cm, with results lasting around 12 to 18 months depending on the individual. It may sound fancy, but not every facility uses safe materials. Some places still secretly use non-absorbable fillers, like polymethyl methacrylate or even industrial-grade silicone substances that can cause chronic inflammation, hard lumps, or even permanent deformation. So if you're considering this, stay far away from clinics without clear licensing. As for lengthening, options are more limited and often carry higher risks. The two most common methods are liposuction of the pubic area to make more of the base visible, which doesn't actually lengthen, but just makes the shaft appear more exposed, and surgery to cut the suspensory ligament that holds the penis close to the body. This second method may add 2 to 2.5 cm in flaccid length, but it doesn't change erect length. Moreover, it can lead to instability during intercourse and unwanted scarring. One more thing that needs to be clarified. So-called penile implants, which are sometimes heavily promoted online, are in fact medical devices used to treat erectile dysfunction, not to increase size. Using them for the wrong purpose can lead to serious consequences. In short, while the desire to change is understandable, you should carefully weigh temporary results against long-term risks. Not every solution is worth the trade-off. And what if I told you that even throughout history, the idea of the ideal size wasn't always what we think it is today? Let's explore a surprising perspective in the next part, where the past might make you see yourself very differently in the present. If you're still watching at this point, thank you for sticking with me. I truly appreciate it and value your time. Please leave the number 3 in the comment section below so I know I'm not speaking to myself. Part 4. When small size used to symbolize intelligence and self-control. Before we end this video, I want to share with you a fascinating historical perspective, one that might completely change how you view the topic we've been discussing since the beginning. In ancient Greek culture, the ideal male figure wasn't about bulky muscles or an oversized weapon, as modern imagery often suggests. On the contrary, most sculptures depicting gods, philosophers, and heroes show slim, composed physiques, and notably the penis was usually represented as small and unassuming. That wasn't by accident. According to the beliefs of that time, a man with a modest size symbolized intellect, restraint, and inner strength. Meanwhile, large genitalia were associated with vulgarity, lack of self-control, or even comedic figures in classical plays. If you ever get the chance to look at Greek art, from statues of Apollo to philosophers like Socrates, you'll notice that physical modesty was linked to greatness in mind and moral character. On the other hand, exaggerated depictions of large penises were often reserved for caricatures or fertility figures like the god Priapus, who was portrayed in an over-the-top and sometimes rather ridiculous way. Why is this important? Because it shows that standards for masculinity, attractiveness, or enoughness have never been fixed. They constantly evolve with culture, society, and the lens of each era. What makes you feel not enough today might have once been a symbol of admiration in another time. At the end of the day, the value of a man is not defined by specific numbers on a ruler, but by confidence, character, and the ability to build honest connections with others. And if you're still wondering how all of this ties back to health and real-life intimacy, then the final part will bring everything together, not just from a medical viewpoint, but from the emotional experience of being a man in the world today. Part 5, True Value Doesn't Lie in Numbers. To wrap things up, I want to emphasize one important message that may help you view everything a bit more lightly. Penis size, though often discussed, is not the factor that defines your worth or your ability to please others. In reality, the majority of attraction, connection between two people, and confidence in intimate life doesn't come from length or girth, but from how well you understand and take care of your own body. Many men have felt self-conscious, confused, or even ashamed about their appearance. But over time, and when equipped with the right knowledge, they begin to realize that the true foundation of masculinity isn't in physical traits. It's in your mindset, attitude, and overall health. It's undeniable that modern society, filled with idealized images in the media, has made many people feel like they're not enough. But when we look at it from a more realistic perspective, and from history, as we just did, we see that standards are always changing. The one thing that never changes is how you treat yourself. What you can and should do is not chase after unrealistic standards, but learn how to care for your sexual health, improve blood circulation, stay mentally strong, and maintain self-confidence at any age. And if you feel like you need a trustworthy space to keep learning, exploring, and walking this journey of protecting your sexual health and inner confidence, don't worry, the journey is only just beginning. Part 6. Masculinity isn't measured with a ruler, it's measured by you. If you've followed along this far, I hope this video hasn't just given you medically accurate knowledge, but has also offered you a fresh, lighter perspective on a topic that often feels sensitive. The truth is, many men continue to silently compare themselves to standards that don't exist, putting pressure on themselves and feeling inadequate over a few numbers. But as we've explored from scientific data to the reality behind enhancement procedures to cultural and historical insights, all of it points to one thing: a man's value does not lie in his size. What truly matters is whether you're confident in yourself. Do you listen to your body, take care of your health, and stay emotionally connected with your partner? Those things, not your length or thickness, are the foundation of a fulfilling intimate life, a peaceful mind, and a resilient, lasting image of masculinity. If you've ever felt lacking, remember, you're not alone. And it's never too late to better understand your body, to change what truly needs change, or to simply stop blaming yourself for something that was never a problem to begin with. I believe that once you start with knowledge, with self-understanding, and with respect for yourself, everything good will follow naturally and sustainably. Dear friend, we've now walked through a complete journey together, from understanding what counts as normal size, how to measure correctly, the most reliable statistics, to possible enhancement solutions and even historical perspectives, all aimed at giving you a well-rounded, judgment-free, science-based understanding. I hope that after this video, you'll no longer feel pressured by invisible standards, but instead walk away with clarity, calmness, and greater confidence in your own body. If you found today's content helpful and want to continue exploring topics that are scientific, practical, and deeply human, don't forget to subscribe and turn on the notification bell so you won't miss any upcoming videos. Thank you for spending your time watching. Wishing you health, peace, and steady strength every day. I'll see you in the next video.